Tonight on Life and Times. We carry health insurance to pay our medical bills, but what happens when your policy is canceled?
They're not about helping people. They're about trying to get out of paying a claim.
Maybe there was a pre-existing condition that was present, and we should go back to the application to understand whether that was really clarified.
They pay hundreds of dollars a month for individual health care policies, and they think they're insured. But more and more people are discovering that their insurance companies can cancel those policies retroactively, leaving them with mountains of medical bills. Why is this happening? Sam Louie has the story of one woman who thought she was insured until.
These are all the medals from the events that I've participated in.
By all accounts, Tarsha Harris is healthy. She's an active 36-year-old who loves to compete.
And this one, 2001.
So she was surprised in May of 2005 when she was diagnosed with endometriosis. It's a common medical condition affecting about 90 million women around the world. With endometriosis, the kind of tissue that lines the uterus starts growing outside the womb in other areas of the body. For Tarsha, it showed up in her navel.
I was at work one day and my belly button started bleeding. It was blood in the area of that shirt, and I went in the bathroom and checked it, and my belly button was bleeding. And also it was swelling up, so I went to seek medical help.
Doctors performed surgery, and her navel was removed to prevent the tissue from spreading. She thought the problem was solved. But then, several months later, her insurance company, Blue Cross of California, canceled her policy. Tarsha felt betrayed.
They're not about helping people. They're about trying to get out of paying a claim that is valid.
Jerry Flanagan is with the Foundation for Taxpayer and Consumer Rights. He calls Tarsha's case part of an appalling trend. He's seen thousands of similar complaints.
This is a classic use it and lose it health insurance strategy where if you dare to get sick, the insurance company is going to cancel your coverage and you're going to be left with huge medical bills.
The cancellations affect only those with individual health care policies. They're purchased primarily by people who are independent contractors or those with no access to a company group plan. It's estimated about 2 million Californians have individual health care policies.
Because of the way that the economy has been in California over the last 3 or 4 years, more and more people are getting inadequate insurance from their employer, or they're an outside contractor for a tech firm and they're buying health care on their own.
Anyone who wants to buy an individual policy has to fill out an extensive application listing any previous medical problems. Unlike company health plans, insurers can reject individual policies based on a pre-existing health condition. But critics claim the insurers are abusing this interpretation.
The minute we saw the facts, we were pretty sure this fit into the exact mold of the cases we've been seeing more and more.
Heather McKeon is Tarsha's attorney. They're suing Blue Cross on grounds of bad faith. Blue Cross claims Tarsha hid a pre-existing health condition.
These people are being denied by their carriers on the grounds that during the application process, which could be several months prior to the injury, they misrepresented some fact regarding their health.
In Tarsha's case, it was a yeast infection. She says when she came down with the infection, it was treated and it went away. All of this happened before she applied for the policy. But several months after she bought the policy, it was canceled. Blue Cross says rescission is a proper and appropriate legal action where someone has obtained health insurance through misrepresentation.
I was angry because they're basically saying I'm a liar, and they're saying that I knew that I had this disease, when in fact I've never had a trace of this disease.
The question on the application is simply states, have you seen a doctor for any care that has not yet been completed? So she said no, because at the time she applied, the yeast infection had resolved itself.
So how does Blue Cross of California respond? We requested an interview with Blue Cross. They referred us to Chris Oman, an industry spokesman and president of the California Association of Health Plans.
It is true that sometimes a claim will come up maybe quickly after somebody has been enrolled, which would suggest that maybe there was a pre-existing condition that was present, and we should go back to the application to understand whether that was really clarified.
In Tarsha's case, her surgery triggered a review of her application. Oman says these complaints are few.
We're talking about 189 complaints for 1.7 million folks who are insured. Each one of those complaints is a serious issue, and we need to understand what it is.
Tarsha's attorney, Heather McKeon, says it's the insurance application that's hard to understand.
They use big words such as with the reproductive questions, endometriosis.
But Oman says there is help available in answering the questions.
There are people at health plans that you can call on the customer service lines who will help you fill out the applications.
He says the goal is not to deny coverage, but to ensure that people with serious diseases are not trying to exploit the system.
The main purpose would be just to make sure that an application was filled out completely and accurately.
The law requires you to show that the patient lied. These companies are going back, scouring medical records to look for any excuse for denying coverage.
Flanagan also points out that insurance companies are not only canceling policies, but doing so retroactively. That means patients are stuck with huge bills they thought were covered.
The patient now is facing collections from doctors and hospitals that are looking to collect on hundreds of thousands of dollars in medical bills.
For Tarsha, those unpaid medical bills have added up to $20,000. Insurance companies say they have to watch out for scammers if they're to keep the prices affordable.
Our products are 10 to 17% cheaper than the national average. So what that tells me is that health plans are providing a good, robust product at a competitive price.
Consumer advocate Jerry Flanagan says he expects more policy cancellations and complaints in the future.
Insurance companies have greater market control. They know that they can deny coverage, and the patients that are left uninsured have no choice but to go to the other mega insurance company that's doing the same thing.
So far, Blue Cross has settled 70 cases out of court for an undisclosed amount of money. And the State Department of Managed Healthcare is also investigating policy cancellations to see if the problem is systemic and in need of a major overhaul. In the meantime, Tarsha's case is in arbitration. She's exercising, watching her diet, and taking care of herself. She also has a new job and is waiting for her company-sponsored health coverage to kick in. But most of all, she's looking forward to putting her battle with Blue Cross behind her.
It was insulting, and it just upsets me that people have to fight, and a lot of people out there won't fight because they're tired.
I'm Sam Louie for Life and Times.